Hello, listeners. A warm welcome to Views on Health. On the program tonight is Dr. Sithara Seneviratne, consultant geriatrician at the National Hospital of Sri Lanka. A warm welcome to SLBC. Once again, Doctor, pleasure to have you with us.
Thank you.
And for the information of our listeners, as a consultant geriatrician, Dr. Sithara Seneviratne is going to focus on issues faced by families in elderly care. As we all know, Sri Lanka has a very large elderly population, and this population, this segment of the population, is going to go up drastically in the foreseeable future. So, having said that, without any further ado, may I invite you, Doctor, to tell us what are the most pressing problems that families face, children, other relatives if they're around, or maybe a caregiver, as far as elderly people are concerned.
Thank you. As you said, Sri Lanka has the fastest aging population in South Asia, and the age expectancy at birth increases each year. And so this has some implications, as you said, with growing segment of older people. So, and the other problem is we have lack of carers because of the shrinking middle-aged population. So the families face a lot of problems taking care of their older parents. And as a result of this, today, sometimes I see children looking after several generations of parents, their parents and parents' parents who are at their homes. So they face a lot of problems when they care for older people, especially the prevalence of memory problems. We call them cognitive impairment, is quite common in the old age. And so this is a huge challenge when you are caring for older people at home. In addition to that, having the physical disabilities, having poor mobility and balance problems, and having recurrent falls due to multiple reasons, mostly the balance problems, and sometimes there are problems related to bladder functions, bowel care, which can be very, very challenging, especially urinary incontinence can be very difficult problems to care for when this is a problem in your parents. And also not only the physical problems but also psychological problems like depression and anxiety, and most of them have behavioral problems sometimes, and they have a lot of problems related not only due to diseases but also due to medications. We call them medication related problems, and these medication regimes can be quite complex. So there are a lot of problems faced by the carers when looking after their parents.
So there are so many issues that I think, as you quite rightly said, that any person taking care of the elderly has to cope with. And for example, Doctor, you spoke of just depression. Now, if a person is alone, it's from my perspective, and he or she can feel depressed because they are alone. On the other hand, if there is a care or someone around to take care, then that person is not alone. Despite that, would there be like a marked sort of sense of depression that you can see in the person because for whatever reason he or she is facing at that age in terms of ailments, or maybe not able to move as he or she did before, maybe lack of friends to speak with or relatives to speak with, maybe a whole gamut of issues. So do you see this, especially like depression or like that is mental? The physical well-being is one side of it and the mental well-being is the other side, and both have to be there at the same time, right, for the overall well-being. So what makes a person feel depressed? Would you just explain that to us?
I think you are quite correct. So, depression and loneliness are two growing problems in our society today, especially among older people. So, as you said, actually, after the retirement age, most of the old adults they are not being engaged in activities that they used to do. So, this kind of a very important thing that eventually leads to things like depression and loneliness. And as you mentioned, now. When the loved ones are not around, people tend to have a lot of loneliness, and loneliness also can lead to depression. So as you correctly said, so it's not not only loneliness is not the only reason that can lead to depression, but it's a significant risk factor. So this we see people becoming less active and being homebound, and as you said, things like not having their friends. And when you talk about aging, it's not only the body and mind, it's kind of we talk about thing called social aging. So when you age, the society around you it change, and when the older person is unable to adapt to this changing social environment, so this can also contribute to depression. And so it's very important to recognize depression quite early, and there are treatment options available, both medical treatment, and there are certain other interventions which are non-medical, we call it non-pharmacological treatment, to sort out these problems. And the recognition is quite important, because this can otherwise lead to a lot of other problems.
Doctor, interestingly, as a medical professional, you must be aware that there are certain centers set up in and around the cities and the suburbs where the elderly go in like once a week or twice a week, and they have a half a day of activities. And of course, it involves a lot of planning, because obviously they have to be transported to the venue and then brought back home. But while they are there, then they engage in various activities with fellow senior citizens, and they get to know each other, and the activities that they have are also planned to keep them happy, occupied. Do you think more and more of such places will be helpful for the population in Sri Lanka, the elderly population?
Indeed. So this has become a national requirement now, because as I said previously, the segment of all the population is in the rise, and these problems are going to be exponentially more common in the coming days. So we have to think about the ways of how to keep these older people engaged. That's the main thing. So we need to think about activity centers, daycare centers, possibly older people's senior clubs where they can get together and talk to each other, engage in different activities. These can be exercises, this can be games, mind stimulation, cognitive stimulation, this kind of activities. So more you keep engaged in activities, so we say less you will age. So aging is when you stop doing things, you start aging. So we need to think about these kind of activity centers, or elderly societies, daycare centers more and more in future.
As a matter of fact, to the best of my knowledge, again, one has to, I think, pay something for this support system that has been set up, because the venue is hired, and then I think they're given a snack. So all that entails some sort of cost, and people are happy to go and pay that money and do that. On the other hand, I guess if people can't afford to do that, then they are deprived of such activities. But would you sort of advise our listeners what sort of activities can they do at home where they can really, they need not go out, but they can be more productively engaged with something in their homes?
Yeah, so engaging in meaningful activities such as reading, gardening, painting, and possibly
Listening to music.
listening to music, and maybe learning new skills by like some hobby that a new hobby, learning a new hobby or new skill can be quite important. This sounds like sometimes very simple things, but these are very important things to keep an older person engaged and prevent loneliness and depression. And things like traveling, exploring new places, and making new friends, spending time outdoors is also very important. And practicing mindfulness and relaxation techniques and can be very helpful to manage stress and anxiety. And also it's very important to keep connected. So this could be by talking to your family members, friends, or healthcare providers, or this can be being connected through social media. So these things can be quite important to prevent loneliness and depression.
I have to ask you at this point, Doctor, what is this age that you're focusing on? When we say elderly, our listeners would like to know from which age onwards do you consider person elderly from a medical
Yeah, for medical
aspect? Yeah.
and demographic purposes, we classify people more than 60 years in older age group, but different people age at different ages. So this is a process which is also called biological aging, and as we discussed earlier, so this includes changes which happening in your body, happening in your mind, and also happening in your society. So it's a quite a broad concept, but we take age 60 as the cutoff from the medical point of view.
Thank you. Going on from there, now again, Sri Lanka's fast-paced lifestyle, I would say, because today, for economic reasons, you find that family members go out to work. If there's somebody working from home, yes, they're in the house. But if they go out, then the elderly person or the parents, grandparents, maybe they are compelled to be at home and be taken care of by caregivers if the family is unable to do so during the day. They come back home after work, yes, they might put in some good time, quality time. Now, in such situations, we had a really extended family living system in Sri Lanka. It was wonderful. And we grew up like that with extended family and parents, grandparents. But now, sadly, that is not common. So at what point do you think this has got to be taken into consideration? Because either children have to move in or parents have to move in with the children, and if they're unable to do so, what does one do?
Yeah, so that's
Could you advise us?
again a very important area to discuss. So as you said now, with change in the society, and we see more nuclear families, and so children has to go to work, and invariably sometimes they have to live separately from their parents, and there could be parents living alone. So and as long as they can carry out their activities alone, I think this can continue. But by the time when they need somebody's help to carry out their basic activities, and we need to think about either having a carer at home, either we have to think about moving parents with children and try to find that support system they need. So this can be due to cognitive impairment if somebody is having problems with their memory. So we talked about diseases like dementia in old age, where the memory can decline very fast. So and the older person might not be safe at home alone. So they can, if they live alone, there can be accidents, and they can have falls, and when nobody is around. So we have to be aware about these risks that happen when they are alone, and then at that point think, all right, now we have to think about some uh, system where we can support our parents and then decide on moving in. And not only the memory problems, sometimes it could be physical disabilities. As I said, with growing age, we see a lot of problems with joints, muscles, and the medical problems, heart problems, which result in a lot of disabilities. And walking, even getting themselves washed in the morning, dressed in the morning, and cooking and things can be very difficult in old age. So when this happens, when they need support for their basic activities of daily living, we need to think about a support system. This can be either by a carer, or it can be kind of a maybe we have to think about the institution, or we have to think about moving with the children to provide this support.
Doctor, something that is of concern where elderly care is concerned is falls. This is a common thing, a common problem, and a problem that anybody would not want to happen. So in this situation, to prevent such things happening, some sort of a mishap happening, what would you advise?
Yeah, a very important question again. Now, falls, the main problem is falls is not sometimes recognized as a huge problem, and can go unrecognized until they develop a major complication of a fall, like something like a fracture or head injury to your head. And so at early stages, if you recognize parents are losing their balance and they are having a risk of falling, then we can do certain interventions to prevent a fall from happening. And these can be a medical review by a specialist, looking at what risk factor that person is having that will lead to falls, and then doing certain things to correct these medical problems. And we also have to think about the environment invariably, and when it comes to falls, so certain home modifications also we have to think about when somebody is having recurrent falls, especially talking about the safe environment to prevent a fall in older people. So sometimes the homes they lived when they're younger age might not be quite safe when they are old. So things like we have to think in the about the environment are especially when regard to the floor. So having a slippery floor, and when there are carpets which are not attached to the floor, and wires going across the floor which has risk of tripping over, and when there's a lot of clutter in the house, those kind of things will result in falls. And in regard to the lighting, so lighting is quite important in old age, because your vision is gradually going down with aging in most people, and having a good lighting is very important to prevent a fall, especially at night when they are going to the bathroom. So I see a lot of patients falling over at night, so we have to make sure all the walkways are well lit. So I always advise, put the light first and then get down from the bed and then go to the bathroom. Don't walk in dark. So lighting is quite important. And having contrasting colors on stairs and door frames and different areas of the house can be important, especially if someone is having vision and also memory problems. And you have to be mindful about slippery, wet or broken floors. And if you have more than 2 floors at home, I think ground floor living will be safer for older adults. And also it's important to have a way of communicating to your family or loved one when you had a fall. So we see some people falling over at home when there's nobody around, and they lie on the floor until they are being discovered. And if they lie for more than 1 hour, in medical terms we call it a long lie. If you lie on the floor for more than 1 hour, there's a risk of getting pressure ulcers, wounds. There's a risk of getting pneumonia, and there's a risk of getting muscle damage. So it can be very detrimental. So having a communication method, it could be a mobile phone, and it could be a wearable pendant alarm where you can press when you had a fall. It can be a bell in the room which you can ring and let others know at home that you had a fall. Some way of communication to inform in case of an emergency. So these things we have to pay attention to when thinking about prevention of falls.
Thank you so much, Doctor. This is so interesting. At the same time, it is quite, I would think, cause for concern because maybe sometimes, Doctor, not everybody can have every step in place to protect the elderly. So it requires a lot of planning. It can entail various costs. And also the fact that it can be worrying if you can't have these measures in place. So we, I guess, finally have to hope for the best that one can do that much, and hope that nothing further will happen, nothing bad will happen rather. Also, Doctor, another point about the nutrition of the elderly. Now, do they have the normal food that the family eats, unless medically if they are advised to refrain from eating certain foods or eat more of other type of foods? That provision has got to be made.
Yeah.
Nutrition is important.
Nutrition is very important in old age, and unfortunately malnutrition is very common in old age. And when you talk about the restriction of food, and as we see a lot of patients with diabetes, heart problems, high blood pressure, high cholesterol, they are getting more common in old age. So usually asked to restrict sugary things and things with high cholesterol, high salt, which might not be sometimes a good idea in old age. So we advise people to lose weight when they are younger, but when it comes to old age, losing weight is a bad sign. So because with losing weight, a lot of people lose their muscles and they lose balance, and which result in subsequently falls and things. So paying attention to having good nutrition is very important, and especially in regard to your protein consumption, because with growing age you tend to lose your muscles. We call this a medical term called sarcopenia. You tend to lose muscle, so you have to take a lot of protein when you're growing old. And also we have to pay special attention to calcium and vitamin D in diet. Vitamin D you get from sunlight, but unfortunately most of our old adults, they are homebound, they don't go under sun during the daytime, and this results in vitamin D deficiency and quite prevalent in our population. So special attention to get sometimes supplements like calcium and vitamin D is also very important. So it's very important to keep yourself hydrated and get good amount of fiber in your diet, right, to help with your bowels. And always eating fresh fruits and vegetables is quite good. So we have to pay attention to your nutrition very well, otherwise it can lead to a lot of problems.
Doctor, question that I think is also important is hygiene. We speak of nutrition, we speak of mental well-being, being active, and taking proper rest, and engaging in sort of activities that will keep them mentally and physically good. But what about hygiene? I mean, baths are necessary. And would you say that unless they have been medically advised not to, that regular baths are important?
It's very important to maintain a good hygiene, especially to prevent infections, and it's good for your mental health as well. So sometimes we see change in behavior, personality, memory, and sometimes, as we discuss, mood in old age, which can sometimes change the people's health patterns, and this can make have implications on your hygiene. And but maintaining good hygiene is always a good health habit.
Doctor, just time is catching up with us, and I'd like to sort of ask a few more questions. For example, what are the sort of common medical issues that the elderly people have?
So there are a lot of problems that arise in old age. So non-communicable diseases such as diabetes, high blood pressure, heart disease, and stroke and things are very common in old age. In addition to those medical problems, things like immobility and falls, and also losing memory, we call it dementia, and the things like neurological problems like Parkinson's disease, and mental problems like loneliness and depression, and urinary bowel incontinence, constipation are common problems we encounter in old age. And not to forget the problems related to medications, which are very common in old age. We call this polypharmacy related problems, and other problems such as muscle loss, and there's a concept called frailty, which by definition is vulnerability to stresses, is a main problem we see in old age. So the problem is often a person has more than one problem, not a single problem, and this managing a person with multiple problems is very challenging. And also, as I said, these frail in old people are vulnerable to medication, so we have to give and treat them with smaller doses of medications and not to over medicate them. So those are the some of the common medical problems and treatment problems in old age.
Doctor, just a question that I don't know how fair it is, but it is happening in Sri Lanka where family members sometimes are not genuinely concerned about their elderly. And then there are other issues that come up in terms of their personal gains. They would want to maybe inherit. These issues are also there. Would you advise an elderly person to address these issues before he or she really becomes old?
Yes.
That way they can maybe protect themselves.
Yeah. So as you said, elderly abuse is quite common, unfortunately, in Sri Lanka, and these scenarios can be quite complex, and there are various types of abuse, which can be physical, can be emotional, sexual, financial, or this can come as neglect as well. And recognizing these problems early and seeking necessary support either from the legal system or the healthcare providers and loved ones are quite important. And things like high caregiver stress and memory impairment and high dependency and social isolation and low income can be some risk factors in which environment we see abuse more. Keeping yourself independent is quite important, and thinking about the good financial management in the old age is quite important. Think about how you spend your days after retirement and planning them ahead is quite important also to prevent these kind of unfortunate incidents.
Thank you, Doctor. And there we have compelled to end this very interesting discussion on issues faced by families in elderly care. And thank you so much to you, Dr. Sithara Seneviratne, Consultant Geriatrician, National Hospital of Sri Lanka, for being with us on the program and sharing your expert knowledge on this very important topic. Thank you so much, Doctor.
Thank you very much.
Thank you too to Nilanthi Puranagedara for technical assistance. I'm Fatima Razikada saying good night and looking forward to your company next Monday, same time on Views on Health.